All right, well, welcome to the podcast, Marja.
Thank you.
You were the first guest at Horizon Deep Tech here in Madrid on the first podcast we're doing here.
Okay.
So we'll take this virgin journey together.
Well, that's an honor, I suppose.
And hopefully it will be well. So we are here live in Horizon Deep Tech in Madrid. And you are here as well. And you are going around this rather big venue, actually.
Mm-hmm.
But before we speak about why you're here and what the company and organization you're representing is doing, could you maybe take me back a little bit and introduce yourself and your background, some educational background, where you come from, what leads you to being here today?
Okay, of course. I am actually from the Netherlands.
Mm-hmm.
So I haven't been living in the Netherlands for about 20 years, but I still feel Dutch. So my educational background is obviously from the Netherlands as well. I studied political communication. And at some point, I don't know why, but I inserted some Spanish in my university courses.
Mm-hmm.
So then I went on an exchange program, and I thought like Spain is great, but it's also very close to the Netherlands. So I actually left, and I did my exchange program in Chile, in South America.
Wow.
And that escalated a little bit because instead of 6 months, I stayed for 11 years.
Oh, damn.
Not studying, by the way.
No,
but,
no. Didn't fail over and over again. No. Oh, yeah. Okay, great.
Yeah. So this is why. Well, I started.
And
I
studying
studied
what?
there. In Chile, it was an exchange program, so I
Yeah,
studied
yeah.
a little bit of everything,
Yeah,
and then
sure.
I went back to the Netherlands to finish my degrees and everything.
Mm-hmm.
And but I by that time I met a Chilean guy. So this is basically the reason why I went back to Chile and to actually live there, work there, and do everything else.
Mm-hmm. So the education you finished back in the Netherlands, which education was this?
Yeah, I started in the Netherlands with a bachelor in communication sciences, and then I did a double master degree in Belgium, one in political communication and one in international relations.
Oh, right, yeah.
I was at it anyway, so like, let's do two, why not? So it was fun.
Yeah, sure. All right, so this leads you to being in Chile for 11 years?
Yep.
And working
Yes.
with something that leads you to the journey you're on today as well?
Weirdly enough, but no.
No?
Nothing
No?
to do.
Wow.
No, I actually worked for the Dutch embassy in Santiago de Chile, in Chile.
Mm.
So it was more the political part of my communications degrees.
Mm-hmm.
So, but it was quite fun. It's a small embassy, but it's about establishing relationships with the Netherlands and Chile and promote the whole economic trade, human rights, and political affairs, basically.
Mm-hmm. And this makes you switch into what you're working with today?
Yeah, at some point Chile is a great country and it's awesome and it's fantastic, and I would advise everybody just go there because it's beautiful, but it's also very far away from Europe.
Yes.
And I still have my friends and family and my nieces and nephews growing up, so I wanted to move a little bit closer to home, but unfortunately the Netherlands isn't blessed with the great climate that we have here in Spain. So I thought like, okay, let's not go back to the Netherlands, but let's go to Spain. So this is why we basically moved to Barcelona back in the day. And one thing led to the other, and at some point we just arrived in Barcelona, and that was just before the pandemic, but like 6 weeks. So I got around. I got my job at Barcelona Health Hub, and then they asked like, okay, when can you start? So my first day at the hub was actually the first day of the lockdown in Spain.
Oh, God.
So it was like the weekend before. It was like, you know what? You just stay home. It's fine. We'll figure it out. So it has been an adventure from the beginning, I can tell you.
Yeah, definitely.
And this is why I started working in healthcare and continuing the whole journey. Back in the day when I started at Barcelona Health Hub, we had about 50 members all working in healthcare. I can later explain a little bit what we do, but and now we're like 600 members. So it has grown a lot. And by now I moved to the beautiful city of Madrid, and we opened up shop here as well. So now we have not only Barcelona Health Hub, but we also have Madrid Health Hub. So this is the reason why I'm here today at the event.
Awesome. Great. So introduce me to Health Hub, or Barcelona Health Hub, Madrid Health Hub, Spain Health Hub. What is the foundation? What are you guys doing?
The Hub is a private, non-profit association, and our goal is pretty simple. It's to promote innovation in digital health. So basically all digital solutions for any healthcare problems. And that innovation is not done by us, so we don't have products, we don't develop, we don't investigate, we basically don't do anything. All that innovation is done by our members. So we have member companies, and at this moment, like I said, we connect more than 600 different companies, both from Spain and beyond, that all work one way or the other in digital health. And just to give you an idea, the ecosystem consists for about half of them, like 300 or 350 of them, are startups and scale-ups in all shapes and sizes, working in all fields of digital health. Think about mental health or telemedicine or robotics or wearables or you name it, and we probably have somebody working in it. Sure. But an ecosystem that only consists of startups is not working, because startups helping startups is great, but it's not getting you very far. So we also connect all the other actors in the ecosystem. Yeah. Think about big pharma, think about insurance, think about investors, hospitals, clinics, universities, basically everybody who does something one way or the other in healthcare. And we are like the umbrella that unites the ecosystem. And we started in Barcelona in 2018, and now, as of this year in 2025, we're also located in Madrid to connect the ecosystems of both Barcelona and Spain. But at the end, we go way beyond, because if you have a company and you are a tiny bit successful, you're going to leave your own region. So there's always some kind of connection with Spain, but normally it's actors that are actually here in Spain going abroad, or companies from abroad going into Spain. Normally there's always a connection with Spain, but it is a very international view basically on the ecosystem. I think that's necessary as well. The boundaries are not there if we're talking about digital health.
Awesome. So in a basic, to boil it down a bit, you take startups in medical or health tech fields and stuff like this, and try to connect them with the real world, try to connect them with big pharma, investors, development, stuff like this. But because, as you say, startups and startups together is great, but it's like it's two toddlers trying to teach each other how to walk.
Yeah, basically.
But none of them know how to walk, so they're like, it's fine, we'll just crawl. This is fine. Yeah. They don't know they're walking, so you need someone to take the next step with them.
And don't forget, the other side also needs the startups. I mean, at the end, if the ultimate goal is to get innovation from research to reality. To get innovation to the patients, to the medical professionals, to the hospitals, to the clinics, to where it needs to go. If we want that, we need a digital transformation of healthcare, and nobody can do that alone. There's not a single startup, not a single hospital, not a pharma, not the insurance that can achieve that. At the end, we all need each other. So it's not only startups that need connections with pharma, for example, with hospitals or wherever, but it's also the other way around. Yeah. I mean, a hospital also wants to know about those technologies that are being out there in the ecosystem, and pharma wants to invest, they have the means, and they really want to be on the forefront of innovation. So we all need each other at the end, but it's very hard because there's so many companies and so many initiatives, and technology is never the problem. I mean, the technology is out there. The problem is implementation, and this is why we are here to guide a little bit all the initiatives and to foster the interactions within that ecosystem to make it work, to get that innovation from research to reality.
So, working in a medical and health tech area, what are some of the challenges you find? Maybe even especially when working in a Spanish segment of the world, you have some knowledge of working in other areas of the world. Netherlands, Chile, whatever. Do you find some special difficulties, challenges working in the health tech sector here in Spain, or at general level, to implement innovative new startups into the established ecosystem of the health world?
I think that generic problems are happening everywhere. They're not only in Spain. Think about, if we're talking about healthcare, think about the lack of medical professionals, the lack of nurses that we have. Every day we have more patients, we have more chronic patients. The cost of healthcare is rising, the demand of healthcare is rising. And to top it off, also the expectations are rising, because we all want to play tennis when we're 80, which is great, but it's not really happening at the moment. those general problems that we have, we see them everywhere. They're happening in Spain, they're happening in Europe, they're happening everywhere. So the problems are the same. Unfortunately, the solutions are not. Because there's so much fragmentation in healthcare systems everywhere. Even within Spain, it's fragmented. I mean, there's no just one system that you can just tap into and then you're done. I mean, we have 17 different regions, and good luck with all 17 of them. And then we have private healthcare and we have public healthcare. So it's fragmentation of innovation, of pathways to get that innovation there. That is a problem. I don't really think it's only a Spanish problem, but it's something that we have to deal with everybody. And this is also why initiatives like Barcelona Madrid Health Hub exist, to make it easier, to make it more agile, and to provide that access to both innovation, technology, connections, and to get it out there.
Yeah, I think you're absolutely right. Speaking health tech and medical areas, a lot of the issues are around the world.
Unfortunately.
Unfortunately.
In a great world, it wouldn't be like this, but it is what it is.
It's a fun thing because it's built on the good thing that we as a world now are in a surplus of food, but our micro brains keep telling us to harvest, take all the food you can. Take. This is cause for obesity and why we are so addicted to sugar and salt and fat, because our brains say, this is good, we need take. But we live in a world we don't need to harvest for the winter. we don't need to fatten up for the winter.
True.
So now we just fat all year round.
That makes it easier.
Yeah, that's true. So a lot of the issues are absolutely worldwide, basically, and I think there's some scalability. If you can break through in Spain, you might be able to scale to the rest of the EU or even worldwide.
Absolutely. At the end, I think that the ultimate goal is to have like a sustainable, scalable, and inclusive healthcare system anywhere. Not only in Spain, but it's something generic for every country, basically. To get there, I think we need a digital transformation of healthcare, and the beauty of many digital solutions are that they are scalable. So if you have a digital solution and it works, there is not a single company in the world that will stay in their own region. Like sooner or later, you will leave your country or leave your city, for my part, but at least you go look for clients, for implementation of your great solutions into other systems, and that's really cool. And this is also why we always have had that international view of healthcare, because I think that's essential. And it's not only about Spanish companies that are successful here in Spain, but it's also about companies from anywhere else going into Spain. At the end, I don't care where you're located. It doesn't matter if you're from Madrid or you're from the Netherlands or from Norway or South Africa or Nigeria or Colombia. I don't care. If you have a great solution, a really great solutions for any problem in healthcare, it doesn't matter where your cradle was.
Yeah, definitely.
Yeah.
So you working with, and your team and the organization, your pharma working with all these amazing startups. What is do you see a struggle that most of these startups have trying to break into the healthcare industry? Or is there something you would advise upcoming startups to think about before going into healthcare industries?
I think it's funny because I think this, like the life of a startup is full of struggles. It's only about struggles. It's one struggle after the other. So it's like, pick one. But let's say, I think access is a problem, obviously. You can have the best idea in the world, the best technology, the best solution, but at the end you need to get it where you need to have the access to the right persons, the right companies, the right decision makers, and that's complicated. We see, especially in the hub, we see a lot of great ideas born out of necessity. For example, a doctor that's in their practices, they see a problem, they invent something cool to make it work, to make it better, which is great. But as a startup, you're no longer only thinking about your product. You also need to think about everything else of a company. And that sometimes is complicated. It's not so easy. But fortunately, there are a lot of great programs out there that can really help startups, especially emerging startups, to get going. But it's still, access is complicated. And the other side of another big struggle is the whole problem of the clinical validation. If we're talking about medtech and digital health solutions, they need, well, not all of them, I have to admit that, but many of them have to be clinically validated because otherwise it's a toy.
Yeah.
If you are a patient and your doctor is describing you that you can use like rehabilitation software, for example, instead of going 3 times per week to the doctor, well, that's great. But you as a patient, you need to know that the software that they are describing to you that it's safe, that it works, and it actually helps you. Because otherwise, you would just go to the doctor, right?
Yeah, exactly.
So this is a problem. It's at least it's some kind of threshold because to get that clinical validation, it's costs a lot of money, it costs a lot of time, and it's not easy.
Yeah.
And if one thing startups do not have is money and time, so this is a problem. So as a hub, we created 2 centers for for clinical validation of digital health solutions, one in Barcelona and one in Madrid, to make this whole process more agile, more cost efficient, and really get those innovation where they need to be, to the patient, to the doctors, or wherever.
So you're also working with local universities and science department, medtech department in those areas?
Yes. We have a couple of universities within the ecosystem, absolutely. However, it's more generic. It's more about creating talent and awareness of both like medtech companies by the students and the other way around. Since we as a hub do not develop or produce anything, we're not so into this science part.
No.
Because once they get out of the bubble and they create a company, this is where we come in, basically. Yeah. But still, they're an essential part of the ecosystem, of course. So I just had a panel here at the event, and I was really, really glad to have academia present as well, because it offers another set of eyes, another point of view, and also a different take on we're always talking about innovation and implementation, adoption, stuff like that. And then, they come around like, yeah, great. But did you think about... And then you get another point of view, which is actually quite nice.
Yeah, 100%. What I speak with a lot of life science hubs and life science accelerators and accelerator programs is most of them actually come back with just about the same advice every time. Is as early as possible in your process, make sure you have control of and know how you will be handling your IPs. So if you have a patent for something, if you have copyright for something, at early stage, make a plan for this, because when you get the investors in, they will buy part of this, and if they are nasty investors, they will slowly dilute you over time. So make sure you have a plan for this. If you don't have it already in an early stage, especially in life science, it will eat you up later, because it will be more difficult later, and probably someone would have copied you, maybe even. But this is the number one advice I get. Is this something you guys are helping these startups as well with?
This is the other struggle. I mean, this is what we said before, right? I mean, having a startup is basically having one struggle after another. I mean,
it's only
so
struggles.
Many. There's so many. Do we help them with that?
Or is it an issue you see in general?
Basically, no.
No.
Because what we do in the hub is that I cannot help you with that. But we have other members in the ecosystem that can. And this is a little bit how we work. So
great.
There's a lot of stuff going on. Like we're not an incubator, we're not an accelerator,
No.
because there are great programs that are already out there. So what we do is we connect you with those that can help you. And so there's a lot of members in the ecosystem that actually helps with the whole IP problem. And it actually works pretty well. But there's another thing also about like early stage. And before my current role as general manager, I've been the director of communication for many years at the hub, and I've worked with a lot of startups, and there's one thing I've seen like over and over again. If you start a startup, start not only as soon as possible with your whole IP problem, which you just mentioned, but also start with your communication journey. People tend to forget that because they think that like I have great technology, it works, we know it works, it's really cool, yeah, fantastic. But that's unfortunately in the real world, that's not enough.
No.
It's you have to start building awareness, building a brand, making people know that you exist, that you have great technology, that you have a great service or whatever you have. If you do not do that, who is going to buy your products?
Absolutely.
But apparently this is something that the people tend to forget.
No, and it's actually, I see it across all areas, really. So any startup in any area. So the thing is that, like you mentioned, you have a doctor who invent a product or solution to a problem he's facing day to day, but he's a doctor. So he's really passionate about what he have created, the product, the functions, but he don't know shit about marketing. He don't know shit about sales. He don't know shit about company management or anything like this. So he believes that he can, but he is so passionate about his solution and his product that he's like, I will build it and it will come to me.
Yes. This.
But no.
Exactly this.
I mean, yes, viral hits do happen, but it's like 1 in a million.
Yeah.
No, you need to create your own success.
Absolutely.
No one is going to do it for you.
I compare this a lot of time with, I have a really stupid metaphor, but it works. Doing your communication journey well, it's about like having a dinner. Imagine you're organizing a dinner for your friends, right? So it's a big dinner. It's like a Christmas dinner for my part. Great. So you're thinking about the menu. You're thinking about what you're going to make. You're going to the supermarket. You're going to pick out a wine. You're making the menus and everything beautiful. Then you go into the kitchen. You spend a lot of time in the kitchen and you're making your dinner. And then you put everything beautiful on the table. Fantastic. And then the dinner is there. And then there are no guests.
Yes.
You forgot to send out the invitations.
Yes.
It's like this. The invitations is your communication.
I think it's a great metaphor.
I think so too.
I think it's a fantastic metaphor. I'm actually going to steal that metaphor.
You're most welcome. No problem. No problem. But it actually, it's true, and it works like this. I mean, how is your client going to find you if they don't know that you exist? They're not going to turn up for the dinner.
And so this is what you created the hub. You don't do the job, but you facilitate a space
Exactly.
for the connections to happen. Of course, you made some work to make sure that some of the connections that are available are something you have helped try to put in there. But you are facilitating the space and not doing the investing, the accelerating, the incubating yourself.
Exactly. Yeah. So. Long story short, we don't do anything.
No. We can boil this down to you don't do anything.
It's very easy. My job basically consists with talking about with a lot of people. I mean, this is what I do basically, talking with people. But it works. It's about one side. It's fairly easy. On one side, it's identifying within that ecosystem what are the needs, what are the problems, what are the challenges that they are facing. Both hospitals, as startups, as pharma, as insurers, everybody. And on the other side is also identifying what kind of solutions are out there, what kind of technology is there, what kind of opportunities is there, and then connect both sides to make it work, to foster the interactions within the ecosystem, to really make it work and make collaboration, innovation happen.
Yeah. Awesome. Well, we're actually running out of time. So
it was quick.
Yeah, it was quick. It was quick. So of course we'll drop some links in the description for the hub and everything like this. But thank you so much for joining us in this podcast. It was my pleasure having you here.
Thank you for having me.
Definitely, and I hope you all have a fantastic rest of the day here at Horizon Deep Tech.
For sure, I have no doubt. Thank you so much.
No, welcome.
Okay.
Thank you.